Well, functional medicine takes a whole body approach to thyroid disease, but with the FDA now moving to ban natural thyroid medications, millions of patients could be forced onto synthetic options. Let's welcome back Chris Jackman, nurse practitioner at Carolina Holistic Medicine. Always a joy to talk with you because I love talking about holistic medicine. When we're talking about synthetic thyroid medication, this is not your first rodeo. This is something that seems to come up over and over again. But before we get into that, why don't you explain to our audience exactly what are certain thyroid conditions?
Yeah, so thyroid issues are very common in the United States, and especially among women. We have hypothyroid, which means your thyroid is underactive, and in those cases, you know, the textbook when you're in nurse practitioner school, you have like the middle-aged heavy woman who's tired and her like hair is falling out, and that's just not always the case. A lot of our patients are very healthy, young people, but they're more tired than they should be, they're more brain fogged than they should be, they can't lose weight, you know, so they may not have all these symptoms that you'd think of as a hypothyroid person, but they need the support because their thyroid is just not functioning at the rate it should be.
Right,
and then you also have
thyroid regulates your weight, it regulates your
temperature,
energy.
your weight, helps with brain health, it helps with you feeling warm, you know, so hypothyroid people tend to feel cold all the time. And then you have hyperthyroid, which is the opposite. You're losing weight too much. You can't sleep. You have headaches. You're hot all the time. So you have the two ends of the spectrum. And our goal is to, like with everything, find that balance in the middle.
You say it mostly affects women. Does it also affect men?
Absolutely. Yeah, we have a lot of men in our practice who do have hypothyroid. They tend to not have as aggressive as symptoms as the women.
Does it hit at a certain age?
Well, a lot of women will start to feel the symptoms coming on in their like 30s and 40s, so it tends to be something more middle-aged people notice. Our bodies are just better at kind of adapting to the issues when we're younger.
Right,
when
of
we
course,
get older. Yeah.
So you could have it but not even realize it. Okay.
Right.
So what are some of the treatments for hypothyroidism?
So hypothyroidism, the main treatment that you'll get in like traditional medicine is Synthroid or levothyroxine, which is T4. And it's a whole complicated system of T4 to T3 conversions and how it all works. But the problem is most women with hypothyroid don't convert their thyroid well from the T4 version to the T3 version, which is the active version. So what happens is they take T4, Synthroid, and they don't convert it well, so they start to feel good and then worse, and then better and then worse. And you have to just keep increasing the dose, and they never really get better.
Oh gosh.
So that's when we start looking at alternative options to the traditional route.
Yeah. What are the alternative options?
So you have synthetic T3, which can be added to the T4 because the body's missing T3. That's called liothyronine or cytomel. But we like to use natural desiccated thyroid, which like Armour thyroid, MP thyroid, which is naturally derived from animal thyroid, and it provides both hormones, the T4 and the T3, and is a natural source, so is absorbed better, tolerated better, and symptoms usually improve faster.
Well, it sounds like a better alternative, so why would the FDA be trying to get that out of the market and only provide a synthetic option?
Yeah, so their argument is that because it's a natural option, you can't specifically say the dosage with each pill. So one pill may be 31 milligrams, and the next pill may be 29.5, and the next one may be 30. So you're not getting that perfect standard dose every single time. Where in synthetic, they can get it down to, you know, the most perfect dose, exact dosage. So they feel like that is a safer route. But we don't see side effects or adverse events with our patients. So.
Well, I was going to say, if a patient doesn't ever come to you and say, you know, that 29 or that 31% really did me in, you know, if it's not a problem, then why are we even talking
I mean,
about
we
it?
monitor people's thyroids every 3, 4 months, 6 months, and the changes in their thyroid is negligible with the hormones, their actual hormones with the medication. So if we were seeing a big shift in the medication, we would see their hormones shifting wildly with blood work, and it just doesn't.
It doesn't happen.
It is a safe option.
Well, it sounds like a lot of patients are out there really worried that their natural alternative could be taken away from them. So This has been an argument year on year, as you had mentioned before we even got started. Why do they keep bringing this to the table and then kicking the can down the road and then bringing it back? And why cause worry amongst the patients that rely on the natural?
Yeah, I think the FDA just they have it on their radar. It's something that they've mentioned and talked about, and it's the big concern is about 65% of our patients are on a natural thyroid, and lots of people. I mean, these thyroid medications were used hundreds of years ago as the treatment. So it's an old treatment, it's a good treatment, and hopefully it's not going anywhere, but we're fighting to keep it around for our patients.
Wonderful. Thank you so much, Chris, for coming on and sharing with us. Always great to have you. Thank you. We'll be back after this.